As you very well know, when the patient comes to you, the first goal is to see what's wrong and what's happening. And by going into the realm of radiology, we are able to at least explore the possibility of what's going on at the fastest and closest possible time, and which is really the prime goal. When a patient comes to us, it is not always 100% that we're able to help them, but if the odds are 50%, we make it 80, 90, or even close to 100% in favor of the patient, so that it will hasten and facilitate management and treatment.
The St. Luke's Institute of Radiology is one of the country's most advanced centers of radiology and nuclear medicine. It is equipped with the world's best and latest imaging and radiotherapy technology, with a staff of highly trained and experienced physicians and technologists.
Well, as you very well know, first and foremost, our goal and thrust is excellence and patient care. Now, we always are attuned to the newest modalities, the newest technologies. That's why we send people abroad to train and do this and do that, and what's the latest. And we have embarked on a specialty of sorts, meaning that for every field that we have, like neuroradiology, we have the 0.2 persons and so on down the line. So in other words, when you have a problem relating to a particular field or a particular part of the body, you have people who are 0.2 guys and they're the expertise. And in that aspect, we have the upsmanship, I think, among other hospitals in the metropolis.
Radiology as a whole is a field of medicine that is really depending on technique and technology. So that here at St. Luke's Medical Center, we know that we are equipped with the best imaging machines and imaging technology there is available. We have CT scan, MRI, ultrasound, and conventional angiography, and even radiography, digital radiography. But coupled with this, of course, machines are machines, which is what we have. However, we also do have the technical expertise to interpret this highly intensive, technically advanced imaging studies.
The services that we have, we are more on the aggressive side. You know, we are organ-based, meaning that, as I mentioned earlier, for every particular organ, we have the 0.2 persons. Secondly, we do a lot of interventional procedures, meaning that patients who have problems, their spine, pain, and so on. We put needles in and then try to alleviate the pain and so on and so forth. Vertebrae that are collapsed, you can strengthen them back by doing or inserting solutions that will strengthen the area and so on and that. So patients who are in the terminal case of pancreatic carcinoma, for example, we can give them treatment with anesthetic, which is good for about 8 to 10 months, or about the duration of the patient survival, and which is really a plus factor both for the patient and the doctor.
St. Luke's is the first hospital in the Philippines with a 256 slice CT scanner. St. Luke's is the first and only hospital in the Philippines with PET CT scanner.
Now, we are very fortunate that we are about the only institution in the country which has a PET CT scan. That means that PET CT is 2-in-1. For the procedure of one, you have 2 modalities. The PET scan is very good for ferrying out any disease process, especially when it relates to malignancy or tumor. And with the PET scan, we can really pinpoint down to the nitty-gritty where exactly is the source of the pain or source of the problem. And in this aspect, with 2-in-1, you have the best of both worlds right away.
PET and CT is actually one of those imaging studies that we call fusion imaging. Okay, CT scan, as we know it, is strictly an anatomic study. It evaluates the body and organs, showing us the anatomical detail. However, the PET is a functional or physiologic study. If there is a particular organ that takes up the radio tracer, then that area is hypermetabolic. Okay. However, the images we get through PET scan is like a cloud. It's really hard to interpret. Having both PET and CT gives the accurate anatomic detail to that region of abnormality seen on PET scan. So now you have a merging of anatomic detail as well as the physiologic and functional aspect that the PET could give us.
St. Luke's is equipped with the country's first 3 Tesla MRI.
Our MRI, we have the 1.5 Tesla, which is our workhorse, and 1.5 Tesla is usually very good and ideal for imaging purposes. And the 3 Tesla is, it's the thrust of this machine is we are able to do things that the 1.5 Tesla cannot do, like in research, for example, in detecting whether a tumor is a recurrence or a sequela of treatment. And we can map out certain elements in the body which will tell us whether this is tumor or not. So in that aspect, we are barely scratching technology, and I think the imaging of the future really is MRI.
St. Luke's is equipped with PACS, or Picture Archiving and Communication System. PACS is a computer system that archives PET, MRI, CT, X-ray, ultrasound, and nuclear medicine images, allowing doctors to retrieve and enhance the images from their PACS-connected computers anywhere, anytime.
PACS, or Picture Archiving and Communication Systems, commonly known as PACS, has revolutionized the system of radiology in a way, because we are able to archive these images without storing them on film jackets anymore. They're in the computer, available for the radiologist, and the clinicians, the doctors themselves, are referring physicians to be able to view them in their computers so that they could see it, and if they are in need of interpretation, there's the radiology information system that is linked with the PACS, so that they could have the image and the interpretation of the image side by side.
St. Luke's is capable of performing a variety of ultrasound procedures for better diagnosis of disease.
The new era of technology, we have ultrasound in our midst. Now, ultrasound is the employment of rapidly vacillating frequency of sound, which is able to tell us what is going on in the body. Mainly, its role is if it is cystic or solid, and in so doing, we can say that whether it is benign or malignant. Half the time when it's cystic, it's usually benign. If it's solid, it can be malignant or benign. And in so doing, half the ball game or half the problem is already solved. So, and one more thing is you can do it repeatedly because it is without radiation. And so this is again a plus factor in favor of the patient and the diagnostician.
St. Luke's is capable of performing a wide range of diagnostic and therapeutic or palliative vascular and non-vascular radiology procedures.
Well, radiology is currently is a very dynamic field of specialty. So with that, you have to constantly learn and constantly be updated as to what's going on. And that's the beauty about being here at St. Luke's Medical Center, is that they recognize that in the same way that the radiologists, the physicians themselves recognize that.
We're always into the forefront of new developments, new technologies, so we always have a program which will send people, residents, fresh graduates, fellows, and diplomates abroad and elsewhere where there is a need to train them, or there is a need to look into newer technology, newer equipment, and so on. By in so doing, we will never be behind anyone, but always at the vanguard of things that are new.
Early detection and accurate diagnosis is the first step toward providing appropriate, customized treatment. With the best and latest technology in the hands of highly trained and experienced doctors and technologists, the St. Luke's Institute of Radiology makes this goal a reality every minute of every day for you. Ultimately, it is expertise.